Hi, my name is Ava King, and today my persuasive speech is over why nurses should have mandatory, legally defined maximum patient ratios. As we all know, nurses play one of the most important roles in patient care. Nurses are responsible for monitoring patients, administering treatments, monitoring and documenting patient change, notifying doctors, providing support to patients, advocating for patient needs, educating patients as well as their families, and so many other important tasks related to the health and wellness of patients. Not only do nurses hold these responsibilities, but they do it for multiple different patients at the same time on a regular daily basis. I believe it is vital for hospitals to establish adequate nurse-to-patient ratios to allow patients to receive the amount of care that they may each individually need. Not only is this more suitable for the patients, but it is also more suitable for nurses, putting less stress on them, which in turn can result in them providing better quality of care. While currently in the United States, only 4 states have these mandated ratios. These are California, Massachusetts, New York, and Oregon. These mandates are currently pending in many states, and I hope to see a rise of established nurse-to-patient ratios in the future. These established ratios improve patient outcomes and allow for better patient safety. It has been shown that mandated state nurse-to-patient ratio laws have resulted in a decrease of medical errors, decreased mortality rates, and improved outcomes in a variety of different categories. Some of these categories include reduced hospital-acquired conditions such as infections, pressure ulcers, and fall injuries. A study completed in 2021, published in the Public Health Journal Medical Care, regarding hospital nurses staffing legislation in New York, concluded that the more patients added to a nurse's assignment increased the possibility of negative patient outcomes, which can even result in patient death. It has also been proven that surgical mortality rates were up to 60% higher in hospitals that are not adequately staffed. It is seen that each additional patient added to a nurse's workload has a higher risk of dying in the hospital. Infections are also a major risk for any patient in a hospital. Inadequate staffing can lead to a higher risk of a patient getting a hospital-acquired infection or an HAI. This risk is increased because nurses have limited time for essential hygiene protocols. Understaffing can also lead to care being missed or forgotten, which can allow for multiple different patients or staff to become more sick than they already are. Understaffing can also decrease the chance of diseases and illnesses being caught before they progress too far. Hospitals without appropriately established patient-to-nurse ratios can also face legal issues. These legal issues arise when hospitals violate staffing plans that are intended to prevent negligent patient care. These violations can lead to state penalties, loss of federal funding, and even malpractice lawsuits. Not only can these patient ratios improve patient outcomes and safety for patients, but it can also lead to improved quality of care. Increased nursing staff can allow for nurses to give each patient increased and more individualized care. This leads to the improvement of patient satisfaction. This also leads to better patient communication, which can allow the nurses to gain more information on not only the patient's physical well-being, but also their mental well-being, which allows for them to provide the appropriate care that will fit their patient's needs. It is also shown that patients generally feel less satisfied with long hospitalizations, So the increase in this quality of care allows for faster improvement and faster discharge rates. Established patient to nurse ratios are not only important for patient care and outcomes, they are also important for the staff nurses, causing them less stress and improving nurse retention. Established patient ratios are so important for the mental and physical well-being of the staff nurses. Nurses with fewer patients are less mentally drained because they don't have the stress from making rushed decisions and have an adequate amount of breaks and downtime. Hospitals with appropriately established nurse-to-patient ratios show an increase in nurse retention. These establishments lead to higher job satisfaction and less nurse burnout and turnover. It can also be said that hospitals with these establishments contain nurses who do not have the intention of leaving the nursing profession, unlike hospitals without these set establishments. Hospitals with appropriately established nurse-to-patient ratios see improvement regarding patient outcomes and safety, quality of care, and staff or nurse retention and stress levels. These establishments are so vital when it comes to the well-being of patients and also the nurses themselves. While again, only a few states currently have mandated these laws, many states have pending legislation regarding these laws, which I hope are passed to allow for other states to better allow patients the care they need. Thank you.